Hello, everyone. Good afternoon. This is Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. Hair loss, whether it is hair loss in men or hair loss in women, is a very common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be underestimated or overestimated. Hair is the first thing that people notice about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systemic factors. Hair fall can affect everyone regardless of their country of origin. And thankfully, effective hair treatment can actually control and even reverse the hair loss process. We are here to know more about hair loss, its management, and more in detail about hair care and its management. So let's connect today with our expert, Dr. Charan, live from Chennai, to make us aware on alopecia. Dr. Charan has done his MBBS from prestigious Sri Ramachandra University-Chennai, MS in General Surgery from Annamalai University and M.Ch in Plastic Surgery from Madras Medical College. He also did his fellowship in Cosmetic Surgery from Belgium. Dr. Charan is renowned in both surgical and non-surgical cosmetic procedures like hair transplantation, body contouring, facelift, tummy tuck, filler, GFC for hair loss, and skin rejuvenation, and many more. It's such a pleasure to have you with us, Dr. Charan. A very warm welcome to you.
Thank you for having me. Yeah, good evening.
So, Dr. Charan, as today we are going to talk about hair loss and more specifically alopecia. So, first of all, we would like to understand what does this word, this term alopecia means.
So, so alopecia means any loss of hair from anywhere in the body. It can be from the scalp, it can be from the body, it can be from the beard, it can be from the axilla. Anywhere, any hair loss from anywhere in the body, we term it as alopecia. And depending upon the causes of alopecia, we have this as a different term. For example, if it's a genetic predisposition in males, we call it androgenetic alopecia. If we have an autoimmune disorder, we call it alopecia areata. We call it hair pulling and then leading to hair loss. We call it traction alopecia. So alopecia is known by different names based on the causative, causative underlying causes.
Right. And in general, Dr. Charan, if we ask that, or if we talk about hair loss, why does hair loss occur? Because in our day-to-day, regime also, we see a lot of hair falling from our scalp. So why does hair loss occur?
Okay, so in order for me to educate you on hair loss, I first need to tell you a little bit about the hair cycle.
Mhm.
So we need approximately an average human being has around 1 lakh hairs in the body, and they are in different phases. Like hair in the body is not in a particular phase. They are in 4 different phases. We call it the growing phase or the anagen phase, and we call it the catagen phase, where it's the resting, involution or the telogen phase, and exogen phase, which is the shedding phase. So, in an average individual, in a healthy individual without hair loss, 86% of these hairs, which is sufficient to say, let's say you have 1 lakh hair, means 86,000 of them will be in the growing phase, and 1% are going to be in the resting phase, and 13%, which is around 13,000, are going to be in the telogen phase. And let's say you so the catagen phase, with the anagen phase, which is the growth phase, lasts around 3 to 5 years. Then the resting phase lasts about a few weeks. The telogen phase usually starts around 6 to 12 weeks. And then we have the exogen phase, which is daily you have around 100 hairs in the exogen phase. So we have, so these are the basics of the hair cycle. So now what happens in hair loss is this growing phase decreases. So from 3 to 5 years from each cycle, so in our lifetime, an average individual living around 70, 80 years has around 30 to 35 hair cycles. So in each cycle, what happens is the anagen phase decreases, the telogen phase stays constant or increases. So what happens because of this? So what is the significance of anagen phases? what we see. For example, this hair, what you see, this terminal hair is basically the result of the growth in the anagen phase. So the length of the hair, everything is determined only by the anagen phase. So if this anagen phase becomes shorter and shorter and shorter, the growth becomes shorter, 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 shorter. Ultimately, the hair does not even go beyond the scalp, basically. So a month we can expect around 1 centimeter growth in a month for an average individual. So if this cycle becomes shorter, then the hair becomes miniaturized, shorter, more hair becomes thinner, and then there is a lot of hair loss. So whatever causes, which causes the hair loss, which we are going to discuss further. So these causes are going to affect this cycle, and based on this, only hair loss occurs. So if you understand which cause affects where, then the treatment protocol becomes much more easier.
Right. You had made it so simple for us to understand the whole cycle. Thank you for that, doctor. And definitely, we would also like to understand who all is affected by hair loss and is hair loss preventable?
Yes. So for both males and females are affected by hair loss, and more predominantly the males who have more androgens. Androgens, I mean testosterone, because it is the most commonest cause of hair loss. Which, but the women are also affected by around 30%. And yes, if you identify the causative reason for the hair loss earlier, so hair loss cannot be completely prevented. Like you cannot do a preemptive strike saying, okay, I'm going to have a hair loss in the future, so I'm going to take all these things in from beginning. So we cannot keep doing that. We can only prolong our healthy hair. We can only keep increasing our healthy habits to have healthy hair. And when you have hair loss in the initial phases, instead of going and figuring out many of the over the counter remedies, you can come to a specialist and get yourself diagnosed. And if you start treating the hair loss at the earliest, yes, it is preventable from being further bad and then leading to a hair transplant later.
Right. I'm sure you'll also agree with me, doctor, that in our society, in our country, we have this, trend of doing a lot of home remedies, and we are so obsessed. Oiling our scalp is one of them. Then using, various type of things, whether basin or multani mitti or some other clay or a curd, etc. So many times, what happens? Why I'm asking this question, that for example, I'm seeing hair loss, which is beyond 100 hairs a day, and I can see some patches or thinning of hair. Instead of going to a dermat, first I'll try some quick fixes. First, I'll try some home remedies. This is a very common, normal practice in our society. We'll go for something, some nuskha. When it doesn't work, or when we see, a larger amount of hair going out of our scalp, that's when we get alarmed and go and land up in front of a doctor. Now, my question is that how effective are these home remedies? Do they work?
Right. So all these home remedies, see, our ancestors were intelligent people. Okay, so they did have a lot of home remedies when we didn't identify individual molecules, like to say like minoxidil or finasteride or any specific drug or molecule which can prevent or reverse hair loss. So what they did was they found substances which had these. So sufficiently to say whatever home remedies which have been passed down do work because they have some amount of scientific background behind them. For example, like you said, neem works. Neem will work in certain conditions. Vitamin C, like lemon work. People use lemon, they leave lemon on the scalp, they do massaging of the lemon on the scalp. People do oil massage on the scalp. And people do, they put eggs and then leave it there and then they wash it over and then they do it. Now, because of the Instagram and TikTok, a lot of essential oils are becoming fad, like, rosemary oil, saw palmetto oil, argan oil, onion peel extracts, everything, is becoming the next rage, basically.
Right.
But what I would like to tell you is, yes, they do work, but we have to figure out for which conditions which might work. For example, a patient might have dandruff, which can lead to a hair loss. And if that patient starts applying coconut oil overnight, leaving it like hours together, he is going to worsen the dandruff, going to worsen the hair loss. And like you said, hair is falling out, patches are appearing on the skin, most likely looks like an alopecia areata, where all these home remedies will not work. You'll have to go targeted therapy. So basically, instead of like trying out all sorts of home remedies, and when you're in grade one and suddenly moving to grade one to grade four is when people realize, oh my God, all the hair is gone. So I need immediate treatment. And when they come to me or when they come to a dermat, what happens is that, they come here and they say, okay, fine, you know what, now I'm going to take treatment with you and I need immediate improvement. But the problem is you've had hair loss for years and you're expecting improvement in days, which is like, literally not possible. So that level of understanding has to be there. I'm not saying home remedies don't work, they do work. We use it as an adjuvant for our therapies also, but for which condition is what a trained specialist can do, basically. Yes.
Right. So the bottom line is, in case you see abnormal hair loss or something which
Yes.
is not normal, as we have already discussed, we do lose hairs or hair do fall apart in
Yeah.
routine. But if it goes beyond what was normal, please go and consult a dermat as soon as possible. Don't waste your time, because you don't know what exactly will work on your condition or what is the cause. So it's important to diagnose the cause, and only in a qualified doctor, qualified dermat can do that. So don't fall for over-the-counter products or home remedies or influencers on social media. Go to the right person, which is a qualified dermat. Now, doctor, one more thing. What happens? Uh, as you just explained initially, that there is a cycle and hair is there to fall. I mean, a certain amount of hair will fall eventually due to that cycle. Now, what happens? Many times we see a lot of hair falling when we go for shower. Many times we see a lot of hair when we are washing our hairs or using conditioner, and we feel that many a times we develop this fear of hair loss if we go and wash our hair regularly, or twice a week or thrice a week, whatever. And what people do, instead of going or asking a qualified expert, they will stop going for washing their hairs. They'll not wash their hair for weeks because they have this fear that if I'll go under the shower, my hairs will fall. So again, is this normal, or the hair fall under the shower is due to that cycle which you have mentioned initially, or it's not normal, or washing less is the key thing to do?
Yes. So, first of all, like you already mentioned, that we have around 100 hairs which are ready to be falling every day. Right. So this hair is not, like specifically is going to fall when you're going to shower. It can even fall in your sleep. If you have in your sleeping and then you roll around, there will be a little bit of traction. Loose hairs will be there. And if they do, if you just look closely, there might be a few hairs on your bed, your pillows also. And some people notice it a lot because they do a lot of rough toweling, and they use the hair dryers a lot. So hair fall during shampooing, like you said, around 50 to 100 hairs is normal, is not something to be alarmed. But if you find these things are like you're just shampooing and suddenly you have a bunch of hair in your hand, and then like every time you do a very gentle toweling and then suddenly a lot of hair, you see so much of hair in this in your towels. And also, first of all, understand that every time you even wash your hair, you're losing some proteins in the hair. So hair is designed that way that when you even wash it with normal water, you're going to lose some proteins. And so if you wash it with an abrasive shampoo, like something with a sulfate or something which is an abrasive or a very scalp, the basic idea of a shampoo is just to cleanse the scalp. It does not do anything much to the hair. But what happens is because of the cleansing of property, there is a tendency for around 5 times the proteins to be lost during a shampoo. So, and also shampoos are known to dry the scalp basically. So inadvertently leading to dandruff. So over shampooing should be avoided. And also, when you do a lot of shampooing every day, over like every day you do shampooing, and then you start shifting over shampoos, and then you kind of like this brand doesn't work, this conditioner doesn't work, that doesn't work.
Right.
And you also have to watch out for certain signs. Let's say you put a shampoo and you have some irritation in your scalp, which means the shampoo is causing some allergic reaction for you. So you need to stop, discontinue the shampoo, and then Because of the allergy, you might have a little bit more hair loss in the subsequent weeks because allergy is there, inflammation is there, so definitely it is going to come back. So in that case, you need to visit a dermat so that, or a professional, so that you will identify the cause early and then you can treat them. So sufficiently from my side, I will advise for a person with more amount of hair loss to be shampooing at least twice a week. Some amount of good amount of hair or robust hair, maybe every alternate days or 3 times a week. That should be sufficient.
Right. You just said, doctor, that even if we wash our hair with plain water, it will make us lose some protein, or our hair will lose some protein. But then these days we are using so much of chemicals in terms of, hair rebounding, hair straightening, hair
Yes.
coloring. Again, we are using blow drying, straighteners, the, heat straighteners on a regular basis. Do they also contribute in more hair loss?
Yes. So, like I said, when you wash hair, you lose some amount of proteins. So, the studies have shown that if you wash hair with hot water,
Hmm.
as the temperature rises, the amount of proteins rises by around 5 times. So, you lose 5 times more proteins. So, imagine a hair dryer which is going to like blow intense hotness. So, it is going to style your hair. Imagine your hair is normally frizzy, and then you put some blow drying and it stays in place. Why? Why does it stay in place? What makes the hair so moldable after a blow drying or after a this thing? Because it is because some amount of these natural proteins are lost in the hair. This keratin is lost. So many treatments are there. So many chemical treatments are designed to weaken the hair so that the hair becomes more manageable. But the side effect of all these treatments is increased hair loss because hair becomes weak, the root becomes weak, it starts falling off. So I have had many patients, in fact, even a very close friend of mine who's had a full head of hair, went around, saw a movie, and then did a straightening. And then he started having hair loss, which could not be controlled. And he was so distraught that, he was in his early 20s. And then finally, we had to start him on treatments. And now he's like sufficiently growing back his hair. And then he's never gone back to doing any of these treatments. So, even one session of these things can trigger a hair fall. Like you said, who are all susceptible. All people with family histories are susceptible for hair loss. Only thing is, we don't know which event can start inducing hair loss. So, a blow drying or even a straightening or a keratin treatment can be the starting point of a hair loss, which you might regret later in life. So that because you will, a keratin treatment might cost you around 4,000, 5,000 rupees for like a shiny hair for 3 months. But imagine spending around 50 to 50,000 rupees to 1 lakh rupees on treatment after that, trying to get back the same amount of hair which you initially had. So I would advise not go around getting all these treatments unless you have a very good, very strong, robust head of hair so that you don't regret it later.
Very wise advice, and I'm sure all of us is going to take this advice seriously. Now, doctor, we all know that diet plays a very important role in hair management or hair health. So, can a diet change the cause of hair loss? Of course, I mean, as you said, it's important to know what's the cause. But apart from that, how important or what is the role of a good diet?
See, absolutely. Diet, a sudden weight loss or a crash diet, a sudden diet which is deficient in certain nutrients, which I'm going to mention, can cause a major amount of hair loss. For example, iron. So we see a lot of pregnant women post-pregnancy. We see a lot of hair loss, and
Mm.
the most commonest the culprit is iron here, because iron can increase telogen effluvium. Because in pregnancy, women are under a lot of stress, and this can also significantly increase the amount of hair fall. So iron, vitamin D deficiencies, calcium deficiencies, you have riboflavin, vitamin B12 deficiencies, and omega-3 fatty acids. So these are like a few foods, zinc. So all these foods which are deficient in zinc can lead to reduced amount of like insomnia, can lead to a lot of muscle cramps. So if you are deficient in all of these things, then there can be a loss of significant amount of hair loss which cannot be treated by anything else. Like for example, you might be deficient in, let's say, iron. You're going to like keep popping biotin gummies because that's the latest Instagram fad. So their hair loss doesn't stop. So what you do, you go say, okay, biotin doesn't work. biotin works, but it does not work on you because that is not the cause of your hair fall. So
Right.
first we need to identify what is the cause of your hair fall and then treat accordingly. And the take home from here is that, like, yes, you can do a lot of diets. Keto, I myself am on a keto diet. So, and you can do a paleo diet and everything. As long as you can supplement these things, supplement iron, supplement vitamin D, vitamin B12, and riboflavin and zinc. If you can supplement all these major, ingredients for which are sufficient for your hair, then I think, a good, or if you cannot do all of these, a normal healthy diet would do.
Right. So, in case you are on any kind of diet, please consult your dermat before that as well, especially if you have, hair-related issues or hair loss, etc. It's always advisable to take the right advice again from the right person, which is a qualified doctor, qualified dermatologist, not the online social media influencers. So please, yeah, do the right thing. That's really important. I could very well, recall last year's Oscar ceremonies where Will Smith had to slap the anchor because the anchor made, a joke of his wife who was suffering from a type of alopecia. We all know a lot of body shaming, takes place, especially if a person is going through alopecia or baldness or anything related with hair as well. I'm sure you also get, patients in your clinic who are really under so much of stress because they are losing hairs or have patches, etc. Uh, what all treatments are there, surgical, non-surgical, where we can, address, or medical, where and by which we can address these things, doctor?
So before I get to the treatment part, I would like to say, before we start treatment on any individual, we will first investigate the hair loss. We would like to know what is the causative, for what is the cause reason for their hair loss. And we come to know based on a few tests that we do in the clinic, and a few photographs, and also a few blood tests which can, like, point out any deficiencies which you might be suffering from, which you might not be aware of. So even a normal healthy individual might be like deficient in vitamin D, vitamin B12, calcium, can have insulin sensitivity. Okay. So we will first check all of these. Once the cause reason is identified, then we will customize a treatment protocol. So the treatment protocol, basically we will give a variety of, because hair loss is not a single disease, it's not a single cause which is causing the hair loss. The treatment is cannot also be a single approach. It will be a multifactorial approach. It will be a multimodal approach. It can be a topical, like applications like minoxidil. It can be finasteride can be applied topically. And we can have oral tablets, like I said. All the deficiencies can be treated by supplements, vitamin supplements, mineral supplements, and now we also have come up with an oral minoxidil tablet for people who have irritation or itchiness while using the topical minoxidil. And oral finasteride has been approved by FDA for treatment of hair loss, like low dose finasteride has been used regularly. And it's a myth that usually people say finasteride causes a lot of sexual side effects, a lot of sexual dysfunction. But finasteride actually is very, very safe in that respect, because it causes less than 2% of those side effects. So basically, some people, and all of these side effects are all reversible on stopping the drug. Some people can have a little bit prolonged effects for around 3 months, but it's completely reversible. And we also have injectables in the form of PRP. We have micro needling available. We have threads available. We have newer treatments like growth factors concentrates which have been introduced. We have threads, which are microneedling with threads can be done. We have low level laser therapies. And at the end of all of these things, once we sufficiently control hair fall, then we go on. If the patient still wants and still is not satisfied with the amount of hair which is present, then we go ahead and then suggest a surgical transplant, a hair transplant.
Right. We have a viewer with us, Rohit John, and he has a question, which is my alopecia temporary or permanent? But then he has not given any further detail. And I'm sure it's not possible just by this question to answer whether it's permanent or temporary. But doctor, is alopecia permanent as well, or it can be, completely treatable?
See, alopecia, like I said before, if you can identify it in the beginning, and if you can, sufficiently follow, a medical practitioner who's trained in that, and if you follow their advice, you can control the hair loss. You can control alopecia so that you have a longer duration with your existing hair. And there have been treatments which are, yeah, which are like newer treatments which are also being like currently under trials, which can also which suggest that they can regrow the hair basically. But right now they're all under studies and trials, and not much of scientific evidence is available. But sufficient to say that if you catch alopecia early, you can have a longer duration with your hair, a healthy hair that is. And even if you catch it a little later, also, like let's say 2 and 3, and each scalp is different because each scalp is androgen sensitive basically. So if you can identify the androgen sensitive scalps, and then if you can, customize the treatments according to them, and I think so, alopecia can be controlled. It cannot be permanently reversed, but it can be sufficiently controlled, right? And
Yeah.
alopecia, as such, usually starts around 18, can go on until around 40 years of age, also, right?
Hmm. What is important again, as we are continuously, focusing on, is to go and consult the right person in the right time. So please don't waste your time over various other things, trying or testing or doing stuff like that. Go to the right person, which is a qualified dermatologist. We have Kiara with us. Her question is: are there different types of alopecia? A, and which one do I have? I'm seeing like whole hair is losing if I comb.
Right. So, like, okay. So, all the types, like, there are many types of alopecia, like I mentioned earlier. Like, we have alopecia, like androgenetic alopecia, we have a female pattern hair loss, we have alopecia areata, we have telogen effluvium, we have traction alopecia. So, there are different types of alopecia. So, each alopecia has a sufficient clinical, characteristics which can be identified on a few simple clinical tests. So if you're combing and then if you're losing a lot of hair, that alone is not a sufficient history for us to actually identify which type of alopecia we might have. So there might
Mhm.
be some other predisposing causes to that, or like you might, like, let's say you're pregnant and after 3 months after a stressful event, or you're going through an exams, or after a very very stressful event, it starts after 3 months. It can be a telogen effluvium, or if you have a family history of hair loss with your father having a lot of balding, your uncles might have a lot of balding. So then you are in your 20s or 30s and suddenly you're experiencing a lot of hair in the frontal areas, and then frontal and temporal regions, and then thinning also. And so usually for females it's usually a diffuse hair loss, but if you do identify a lot of frontal and temporal thinning, and also face and increase in the amount of facial hair, then you might be suffering from androgenetic alopecia. If you're having multiple bald areas in the scalp, suddenly spontaneous development of bald areas with patches of hair falling off, then you might be suffering from alopecia areata. And many a times we, like, our hair is weak. Many a times, like, we just tend to do this. We tend to pull our hair and see. We tend to do all this. We tend to do all this tight ponytails and all that.
Mm.
So that times our hair is already weak. So if we can kind of like put it under more stress, we induce our traction alopecia. We call that hair pulling basically. So all of this, it can be any one of these things, unless you go and see a dermatologist who can actually identify what kind of hair loss it is, because each one has its own pattern. So we can just identify your hair loss and treat it accordingly. Thank you.
Right. Now, doctor, I would like to ask this one question because what happens, as you said, there are surgical and non-surgical ways of treatment or controlling alopecia. What happens, because we see quacks as well doing or serving these treatments. Doctors like you who do it themselves in their clinics. Again, we have like clinics where doctor doesn't do it. Their the supervisors or subordinates will do it. plus quacks and saloons, etc. They all are there. And of course, the price, because again, money do matter, economics do matter here. Now, of course, the price will vary in everywhere. Now, what should be the criteria when a person is going? Okay, maybe he had gone to the right person, a qualified dermatologist, a qualified doctor for seeking advice. But now, when he or she knows that this is what I need, procedure wise is what I need to do, they have this variety of options where to go, how to choose the right, place to go for these procedures, whether surgical or non-surgical.
Right. So once you have identified that you have a specified type of hair loss, and also then you are sufficiently convinced that you need to get a surgical mode of treatment done. First of all, I would advise them not to undergo the surgical therapies if they are having an active hair loss. No trained specialist will definitely advise a hair transplant when they are losing hair. So what happens is you lose hair here, we'll keep hair. Then if you have hair loss, the hair loss will progress here. So you have hair, you have an area of no hair, and then you will still have hair behind. So that will look like a cornfield appearance, which is very, very bad look. So what you will try to do, you will chase the hair loss. So the first thing before you do a surgical intervention is to make sure you at least have controlled your hair loss or have had treatments to control your hair loss. Because controlling the hair loss is the first step of any surgical hair transplant. Second, I ask your hair transplant surgeon for any pre-post pictures. Also, if the transplant surgeon says you're going to get operated in the same clinical room, please avoid them, because hair transplant in our hands and trained specialist hands is done in an extremely sterile environment. It's like any other major surgery. Takes over around 8 hours to do it, and it's as important as getting yourself, any other major surgeries which involve an anesthesia. Just because you're getting a local anesthesia doesn't mean it's something to be taken lightly off. And also, and you should also understand, all of this sterility will come at a cost. Okay, so anybody quoting, let's say, dirt cheap rates, saying around like we can do it for 20,000, 30,000, or 40,000 or anything, is
Mm.
basically scamming you, because no skilled person is going to spend 8 hours of their time and energy, and and if they come and say I'm going to transplant around 5,000 follicles into you, which is not possible in a single 8 hour period unless it's done by a
Yes.
major team. So you should have all these things. You should also see the ambience of the thing, and you should also see if it's being done in a good operative or a sterile operative environment and done by a trained specialist. And because you are the one who's undergoing the procedure, and more than your money, your safety matters the most, basically. So you need to identify the right people, and also you should also, they will also, usually what we do is we show them the scalp, like occipital region. We test the occipital region and we show them how many hair follicles they have. We test the beard, we check the axilla, we do the body hair assessment, and we see, okay, what is the amount of hair follicles which are necessary to cover your scalp, basically. It's not a number, but basically, like my mentors have told me, that hair transplant is an art. It's not a surgery, it's an art. It's an art of camouflaging a large area where you have lost around 10,000 hairs with around 2,000 to 3,000 hairs. So only an artist can actually camouflage the level. And if somebody is going to come and tell you, okay, you know what, I'm going to give you an 18-year-old appearance, please stay away from the person, because it's going to look extremely bad, because your whole face is going to sag and your hairline is going to come somewhere here. So it is going to look. So these are the things you have to have realistic expectations.
Right.
Okay, so and these are just a few things which I would like to mention. That's all.
Right. It's important to keep these points in mind. So we have Kirti Kapoor with us. Her question is, can you recommend any specific test or evaluation to determine the cause of my hair loss?
Actually, yes, there are a lot of blood tests. First of all, we would one test will not do for all. So usually there is a gamut of blood tests which we will take, because, like I mentioned before, there is a lot of vitamin and mineral deficiency which can cause hair loss. And also dermatologists have, we have these hair pull tests, and also this cameroscopy, which can be dermatoscopy, which can see the amount of hair follicles and the miniaturization. So yes, if you go to a dermatologist nearby you, they can in a jiffy identify which type of hair loss it is, and also give you some tests which will make you control your hair loss as fast as possible.
Right. We have Tina Bhargav with us. Her question is, what can I do to minimize further hair loss or prevent it from recurring? And we would definitely like you to tell us some, hair care tips as well, doctor.
Right. So, like I said, a healthy hair is not an isolated thing. It's a result of a healthy living, basically, which means healthy diet, a diet which is rich in all your, like I said, all your vitamins and minerals,
Mhm.
and a lot of water, exercise, sleep. So if you all have all of these in control, then I think 50% of your problems are solved. And secondly, avoid over shampooing and avoid skipping of brands. If you want any shampoo, you can go for any pH balanced shampoo, opaque shampoos, that is, so which will not irritate your scalp too much and not make it dry too much. So just stop jumping around from one Instagram fad to the other and then start trying more and more shampoos, because you're just harming yourself. And people with already have had who have had hair loss, I would suggest them for them not to go for any coloring or any keratin treatments or any hair straightening until and unless like the hair loss have completely stopped and they're under good treatment and the dermatologists have advised, okay, now your hair is safe enough to withstand all of these. So, and some people do have this myth, like wearing helmets or wearing being in a constrained space or wearing a cap can cause hair loss. Usually that's not the case, but what it does is, let's say you have a helmet and you keep wearing it every day for half an hour a day, you're going to sweat, the sweat is going to stay there, and then what it causes is it causes more amount of dandruff to form in your scalp, and
Mhm.
the dandruff is going to weaken your hair, and then there is going to be hair loss. And also the helmet can pull on your hair, lead to attraction alopecia. So a clean helmet wearing is absolutely essential, but the helmet cannot cause hair loss on its own unless you maintain it as dirty as possible. So you need to clean your helmet once in a while, and also don't over shampoo your scalp and treat it as gently as possible. And yes, that's about it. Most, I think
And
I've
doctor,
covered
as you
most of
have just mentioned about dandruff, and dandruff is again very common in our, society. Now, what happens when we have dandruff? What we do normally is to apply a lot of oil on our scalp, or use curd, or again some home remedies, or will use over-the-counter anti-hair fall or anti-dandruff shampoos and conditioners. Is it okay to do, or what else we need to do?
see anti hair fall shampoos are a myth. Okay,
Okay.
so the idea of a shampoo is to cleanse the scalp, and for the 2 minutes or 3 minutes your scalp, the shampoo is on your scalp, it cannot do much for you to reduce your hair fall, basically.
Correct.
And most often the dandruff is caused by the organisms that's already present in the scalp, like you, me, everybody has organisms in the scalp. And when one particular species, if they suddenly starts growing more, let's say 75% of the total flora, and then it causes producing more scales, becomes more dry. And one of the major reasons is over shampooing. So what we do is dryness of the scalp, we put in more amount of oil. Oil actually serves as a nutrient for these dandruffs, so which starts growing more and which causes more hair loss, basically. So I would and any balanced shampoo would help. Anti-hair loss shampoos I would try to avoid because they have more number of chemicals. But serums, yes, let's say some amount of fungus is there, so antifungal shampoos work to some extent. And some, and all these home remedies, like I said, like neem works good in this, but don't just take neem and then apply it on this thing, because neem can cause a lot of allergies. So any balanced shampoo, any with known scientific ingredient which is known to reduce hair loss or to reduce dandruff can be used. I'm not like naming a particular, this is the only shampoo which you can use or anything, because there are a lot of good shampoos on the market, there are a lot of good serums in the market, but it is up to you to identify which is what and then to use
Right. And before we sum up the whole session, Dr. Charan, any take home message for our viewers?
it. Right. So basically, yes. So look at hair as an extension of you. Healthy hair, like you said in the beginning, hair can give you make or break you. A good hair
Right.
can give you a lot of confidence, and a balding person can be very depressed without even knowing why he is being
True,
depressed.
true.
So treat hair as you would treat any other part of your body, with care and with concern. And any sign of hair loss in the beginning, I would again request you to just immediately go and suggest, consult a dermatologist or a trained professional, rather than trying out the millions and the billions of the Instagram and the TikTok fads, which are all there.
Huh.
And this is personally a request because I see a lot of people in the young age, like 16, 18, 20, 22s. They're all coming there and they're coming at 3 months. I have 6 months for my marriage. Can you do something about my hair loss? So all of this, it's very pitiful to tell them that no, hair loss cannot be treated in 6 months. You need, it is a long process. So
Right.
you identify that, and you also see your family history. If you have parents who have balding, if you have uncles who are balding, be aware that you also can get it. Okay, 70% chances that you can get it. So you try to make sure that you live a healthy life, you have good amount of protein. Protein is the building block of hair. So any kind of diet would do, but proteins are must. And make sure you're not deficient in iron. So a general overlook, a general healthy life would also like reflect in a healthy hair. Yes, thank
Right.
you.
Thank you so very much, Dr. Charan. It was wonderful talking to you, and thank you for your valuable time in this very informative session. Thank you very much.
Thank you. Thank you. Thank you so much. Thank you. Thank you for giving me this opportunity. Thank you.
It's a pleasure, Doctor. Thank you. And viewers, thank you for your excellent participation. Stay happy, stay healthy, and stay connected. Thank you. Goodbye. Have a good day to all of you.